To the rebound now. Doctors across the country are seeing a surge in sick patients, not from COVID-19, but from people delaying routine preventative checkups. Chris Conti takes a closer look at why putting off that regular doctor's appointment could create long-term health issues.
Where patients could once be found, there is a lot of silence these days, as COVID-19 has kept countless Americans at home for fear of contracting the virus.
A huge piece of what we do, especially in primary care, is prevention, not reaction.
As a primary care doctor at Vanderbilt University, Dr. John Scott can understand why people were initially delaying preventative care back in the spring. But now, many of the patients he's seeing are sicker, having delayed routine care for months.
We're going to have to pay that bill later, and the cost is going to be much greater.
What worries Dr. Scott the most? A 50% drop-off in cancer screenings across the country. With Americans avoiding the doctor, they're putting off breast, colon, and cervical cancer screenings.
The impact of that is significant as we think about the benefit of catching cancer at an early stage.
Nearly a third of Americans have put off health care during COVID-19, which is why physicians nationwide are urging people to schedule that regular checkup sooner rather than later.
Healthcare is a marathon, and you want to put the finish line as far out as possible. So if we start skipping steps along the way, then we're not going to get to the finish line that we want.
And according to the CDC, 40% of Americans are struggling with mental health issues right now, something doctors would regularly screen for at most checkups.
We're looking to intervene at every opportunity for that.
And so you're missing those opportunities.
Absolutely.
And since it could be months or even years before the pandemic is over, Dr. Scott wants people to at least consider making that trip to the doctor.
It's safe to return. It's safer to return than not. When we look at these long-term issues, there's medical care that needs to occur.
I'm Chris Conti reporting.